Hello all, I am Dr. Walter from SNS College of Physiotherapy. Now we have seen the last two videos based on the amputation, the causes, the physiotherapeutic approach, and the main thing, the reveal of the phantom limb pain, the heading. Now we are going for the vast advanced technique in our physiotherapeutic approach. As you might feel why physiotherapy plays a great and vital role in this amputated cases. By in this end of the video, be straight and be calm and learn well. Thank you. Now going for the rehabilitation, I have written prosthetic limb. While we are going for the final year, we are having a different separate subject, rehabilitation medicine. It's not about just rehab. We are adding our name as rehabilitation medicine. As we know, for a condition, if we give a medicine, it is curable. Yes, we know for a fever, what we will take, take a Dolo 650. Yes or no? For many n number of conditions, we'll be taking different medicines. And this rehab is also a medicine, and we are part of this rehab medicine. How? When in a patient is going for the amputation, we can give the prosthetic hand or prosthetic leg, but we need to follow certain stages of getting these types of advanced techniques. How? After the patient is going for the home, we as physio, we need to train the patients in the home care basis. How we need to train? We need to follow the strengthening exercises for the amputated leg, and not only for the amputated leg, we need to concentrate onto the opposite side, that is the normal side of the leg or hand. For example, if we take a patient of 22 years male, if this patient is affected with the RTA and his knee, that is below knee amputation has been done, good, it is stumped and all these techniques have been applied. Now going for the rehab protocol. How? Strengthening of the amputated and the strengthening for the normal leg, both should be done, along with the strengthening of the two upper limbs should be done. Why? At first stage, we need to implement the walker with a hopping technique. The patient should hop and walk. Before hopping, strengthening of the static quads should be applied, and onto the amputated leg, SLR with help of the hip should be done. These things should be done on daily basis, and this will help the patient to overcome the strength loss, or else in detail we learn that is the muscle wasting. Most commonly, the amputated patients will be going for muscle wasting, strength loss, and even psychological barriers will lead them to death. We as physios should not leave any of the lives, as we need to implement the strengthening exercises for the normal limb and the amputated limb. And after getting the proper strengthening exercises for months, we need to implement the prosthetic limb, either for the upper limb or for the lower limb. If we take this 22 years old male of lower limb, we need to apply the below knee prosthetic limb. As in India, we are having n number of prosthetic limb. We might have seen in local terms also, we might have seen many terms of the prosthetic limb we might seen. Okay, now this application of prosthetic limb onto the leg makes them to feel better and they can walk on their own. But is it so easy to walk on the own without any type of sticks, canes or pads or tripods? No. Strengthening plays a very good play, and for this strengthening, physiotherapy plays a vital role. Even after placing the prosthetic limb, the patient should go on with the strengthening exercises for the both of the limbs and even for the hands. After gaining confidence and gaining the strength of walking on alone, we can opt for different types of prosthetic limbs. When we take the hand, if the below elbow is done, we can implement a prosthetic hand with different types of hand. For example, you might have seen in a small cartoon shows, we might have seen a prosthetic hand with a needle or a spoon or a crowbar or anything hand being applied. These things are most advanced, and also in the Para Olympics, this prosthetic limbs plays a vital role, and for every Para Olympics patients, and they are striving for the goal when they are going for the lower limb amputation, it is only because of the help of a physiotherapy. And as I told earlier, at the end of this video, you might feel proud why we choose this physiotherapy. And in normal days, we may say they are disabled patients. Never. They are differently abled patients with the help of the prosthetic and also with the help of physiotherapy. And thank you all for this wonderful video. Thank you.